High functioning anxiety. So this presentation is going to give you a quick introduction to high functioning anxiety. So what is high functioning anxiety? Now, because of the words high functioning, this anxiety can very often be misperceived as being a positive thing. But in relation to high functioning anxiety, the words high functioning are referring to the kinds of people that may be impacted by this. So when functioning or high functioning is included in a diagnosis or the name of a condition, it just simply relays information about the kinds of people that have it and the ways in which it may impact their day-to-day lives. So people with high functioning anxiety are not prevented from achieving great things. Now, with other forms of anxiety, that anxiety can be a barrier to certain things being achieved, but with high functioning anxiety, the condition may be, at least in part, because of the great things that they are able to achieve, which I'm going to explain in more detail as we work through the presentation. Now, just because the anxiety may be playing a part in the high achievements does not mean that they do not have a problem. And it certainly doesn't mean that the condition is the cause of their success. It's very difficult to establish whether the anxiety is the cause of the success or the success is a cause of the anxiety, which again we will talk about in more detail. So what is the difference between high functioning anxiety versus other anxiety conditions? So let's start with anxiety. So when we talk about anxiety, we very often talk about, panic attacks or anxiety attacks, and that's in relation to the physical symptoms that people will experience, such as, the racing heart, their breath either becoming faster or shallow, tightness in the chest. The individual may feel as though they're going to throw up or pass out. They may experience feelings of being lightheaded. And very common with anxiety is the unusual thoughts and feelings, like the feeling that they're going to lose their mind or that your life is out of your control. And then this will then lead to safety behaviours putting in place, and one of the most common safety behaviours is avoidance. So somebody wanting to avoid doing things to avoid them symptoms. So with anxiety, when we talk about anxiety, we associate it with the physical symptoms and safety behaviours. Now, when we talk about high functioning anxiety, we very often will talk about silent anxiety attacks. Now, the reason for that is because somebody with high functioning anxiety is less likely to experience the physical symptoms that we've just spoken about. However, they will experience the emotional symptoms, like those feelings of being out of control, but the physical symptoms are not something they are likely to experience. And that is just simply because people with high functioning anxiety disorder may simply have got really good at avoiding things that trigger their attacks. So this can be a reason why somebody with high functioning anxiety may not actually class themselves as being an anxious person, and therefore they will kind of go undiagnosed with it. But nevertheless, anxiety is not all about physical symptoms. There are many emotional and behavioural symptoms, but these symptoms are not spoken about as commonly as the physical symptoms of anxiety. So somebody with high functioning anxiety will craft their lives around avoiding the things that make them feel uncomfortable, and they will have got really good at doing this, and quite often may not even realise that they are doing this because it's become quite habitual for them. And the fear they experience can drive them to put more pressure on themselves, to work harder, to please more people, which we will talk about in more detail as we go through the presentation. And they may experience success in their professional lives because they are high achievers, but they don't have time or energy left to maintain healthy relationships or to take care of their own physical and emotional health, which eventually can lead to high levels of stress and possibly burnout. Okay, so who gets high functioning anxiety? Anybody. Anybody can get high functioning anxiety disorder, just like any other anxiety disorder. We are all human beings, and at any point in our life we can experience these things, and I'm going to talk about some possible reasons for that. Now, people with high functioning anxiety disorder are usually very successful people, but the fact that they are usually diagnosed as adults means that it can be difficult to determine whether their success is because of their anxiety, and that's the anxiety is causing them to push themselves, or whether they have developed anxiety because they have pushed themselves. It's like, what comes first, the chicken or the egg? Now, with many other forms of anxiety, diagnoses are made much earlier on, in childhood. But with high functioning anxiety, it's very often adulthood, because it can take that long for it really to start to impact people because of the stress and the pressure they put on themselves and all the behaviours that they have in place. Now, most cases of high anxiety disorder are probably a result of life circumstances, which we will talk about in an upcoming slide. Okay, so how is it diagnosed, and can it be misdiagnosed? High function anxiety is often diagnosed in older adults, where, as we've just mentioned, but with other forms of anxiety, it's very often diagnosed in childhood. And this is largely because high function anxiety lacks many of the most recognisable symptoms of anxiety. As we've just spoken about, the physical symptoms are not there, it's more behavioural symptoms. So yes, it can, take quite a long time to be diagnosed, and that can be because the person doesn't recognise that they have the symptoms of anxiety, and also because there are other disorders that possibly can be misdiagnosed as being. Now, one of them disorders is OCD. Now, sometimes somebody with high functioning anxiety disorder, they can want to put in specific routines because they become perfectionists, and they want things to be done in a perfect manner to ensure that they don't fail, to ensure that they continue to achieve high standards, because this is part of the high functioning anxiety behaviours. Now, because of them specific routines and that perfectionist trait that they have, it can very often be misdiagnosed as OCD, which is obsessive compulsive disorder. Okay? Their attempts to avoid things that trigger their anxiety may also make their symptoms look like other disorders, such as depression. And again, this can be something that's misdiagnosed because of this need to avoid things and how that will, affect their mood. That can then be misdiagnosed as being depression. High function anxiety may also be initially noticed because of chronic stress. So again, somebody with this disorder can be kind of labelled as being stressed. So because they're similar traits to obsessive compulsive disorder, similar traits to depression, and similar traits to other anxiety disorders and chronic stress, people can be misdiagnosed with this condition. Now, yes, this is a form of anxiety, and yes, the treatment for it is the same as other forms of anxiety, but if somebody is misdiagnosed, then the treatment that they receive may be the incorrect treatment. So with CBT, if somebody's diagnosed with obsessive compulsive disorder, then they will receive the treatment for obsessive compulsive disorder, which is a different treatment plan. If they're diagnosed with depression, they will receive different treatment, because that is also a different treatment plan. So it's really important that we diagnose the right disorder and we get somebody, the right support that they need. So this is the reason why raising awareness of high functioning anxiety is really important, because these are the symptoms of it. So of course, somebody who's been struggling with high functioning anxiety for many years, it's understandable that that is going to affect their mood. So, the low mood would be a symptom of the high functioning anxiety. And of course, the constant pressure that we put on ourselves as part of the high functioning anxiety, of course, over a period of time, that is going to lead to chronic stress. So again, that is a symptom of the high functioning anxiety. So we don't want to be treating the symptoms, we want to get to the root of the problem, and this is why we need to understand it and make sure somebody gets the correct diagnosis. This can also include problems with high blood pressure, heart problems, poor immune system, digestive problems, muscle pain, weight loss, weight gain, and many other symptoms. But again, they are all symptoms of the high functioning anxiety. So what are the causes of high functioning anxiety? So let's talk about experiences first. So you will know by now that I very often speak about the importance of our experiences when we are identifying the causes of our anxiety. I am yet to meet a client where we haven't been able to identify a past experience that has contributed to their anxiety. Now, there is a misconception that this past experience has to have been something traumatic or abusive. This is not the case. I have very often worked with clients who, have had very loving and caring parents, and they've had no negative experiences in high school, but yet their parents may, for example, have had quite high standards, and with all the best intention, they've wanted them to do really well in school, and as a result of this, they've had they've kind of had high expectations. Now, these high expectations can then cause somebody to be anxious in later life, because this fear of letting people down, this fear of not being good enough, this fear of failing, for example. So it doesn't have to have been a traumatic event. Okay, I'm a massive believer that there is always a reason, and like I say, I'm yet to be proved wrong with that. Now, we also have genetics, so there is a genetic link with anxiety, but what this means is, it doesn't mean you're born anxious. It means you are, like any other genetic link with a physical illness, for example, it means you have a predisposition. So depending on your life choices and your life experiences, and your lifestyle, I suppose, will kind of determine whether you are likely to develop that, but it does not mean you are born with it. And then we have the biological factors. So what we mean by this is like brain chemistry, hormone levels, nutrition and gender, etc. Okay, so they're the possible causes. Now let's move on to the characteristics. So the characteristics of people with high functioning anxiety that are very often thought as the positive characteristics, and I'll explain to you why these are not so positive in a second, but these are the positive characteristics that can be linked to somebody with high functioning anxiety. And it doesn't mean that they will have all of these are just some of the ones that have been identified. So an outgoing personality, very punctual, proactive, organised, very detail orientated, orderly and tidy, and that could be at home and at work, very active, always on the go, very helpful, high achieving, as we've spoke about, very loyal in relationships. They may appear to be outwardly calm, but that won't be the case on the inside, and they will come across as being quite passionate. So as you can see from these, you're probably reading these and thinking, well, they're not bad things, what's wrong with them? Well, I'm going to explain to you now how they kind of link to the negatives. So these are the negative characteristics of somebody with high functioning anxiety. So they are very likely to be people pleasers. They will be overthinking things a lot, so that's constant worry and negative thoughts. They will lose a lot of time, and that will mean like they will arrive early for things or they will stay late. So they might be somebody who gets paid to work 8 hours a day, but they actually work 12 hours a day. Constant reassurance seeking from people either at work or family members. Procrastination, so that's putting things off that they don't feel like they can do to a high standard, for example. They will have an inability to say no to people. Constantly busy, never taking a break. As a result, they will feel exhausted a lot of the time. They will have an inability to enjoy the moment. So because their mind is always either in the past thinking about things that they've not done, or in the future thinking about things that they need to do, they will very rarely be present in their life in the here and now, which obviously means that they miss out on time with, making new memories with family and friends. Perfectionism, which we've already spoke about, that need to do things to a very high standard through a fear of failure. Sacrificing their own needs for others and comparing themselves to others quite a lot. Never feeling fulfilled despite the fact that they have achieved so much, and they're respected by a lot of people. It's still never enough. They constantly put this pressure on themselves to do more and be more, and they will have a very limited social life because of the fact that they are constantly trying to achieve. Now, these negative characteristics are the reason for the positive characteristics. Now, what I mean by that is, if we think about some of the positive characteristics that we spoke about, punctual. So they will come across to somebody as being punctual, but really what that is they are putting pressure on themselves to be early to an event because they're worried they're going to let people down. They're worried people will think bad of them. They're worried about, if they're not there early, then they won't get things done, and that will be, that could result in failure, whatever it might be. So even though to other people they may seem punctual, this to them is this pressure on themselves to be early and not kind of let people down. So they lose a lot of time. So let's look at very helpful. Again, very positive trait to have, but this being seen as helpful can come from the inability to say no to people because they feel like they have to say yes to everybody through fear of somebody not liking them, through fear of people thinking bad of them, or the people pleasing that can come from that. So other people will see them as being helpful, but really to them it's this fear of letting people down, or this people pleasing behaviour. Loyal in relationships, again, that would link to this people pleasing. They can come across as being very loyal because they never say no to people. They will always do what's asked of them, and people will as a result think that they are very loyal. But when they on the outside they may appear very calm and relaxed when they're saying yes to all of these things, but on the inside it is a very different story. And again, the high achieving is classed as a positive characteristic, but that high achieving is coming from the perfectionist, the high standards, the fear of failure. Organised is coming from that need to, to please people again and get things, make sure that they don't make mistakes and that kind of thing. So all the positive characteristics on the previous slide, if you were looking at them thinking, well, they seem fine to me. Yes, that's how people with high functioning anxiety seem on the outside, but on the inside, them behaviours are being driven through this constant fear. And this is why it's really important to understand it. Now, very often with high functioning anxiety, when it is diagnosed, someone with high functioning anxiety can fear having treatment because they worry that they will stop achieving, and they will, all these things that they've created, the fact that people do like them and that they've got this good reputation for being reliable and helpful and, proactive and punctual and whatever it might be, they worry that that will all be taken away from them. But that is not actually the case. The anxiety is not the reason why all of these things are happening, but nevertheless the constant pressure to be this all of the time is what is kind of causing the problems that these people are experiencing, and that will lead to the stress and the burnout and the low mood, for example. So how is high functioning anxiety disorder treated? So once high functioning anxiety disorder is diagnosed, it's treated in the same way as other anxiety disorders are treated. But like I said before, it's important that we get the right diagnosis so that it is treated as anxiety and not depression or OCD or stress. So depending on the preferences and the circumstances of the individual, treatment may consist of just medication or just therapy, or a combination of the two. So there's been loads of research done into CBT with medication, and it has been proven that CBT and medication work really well together. CBT on its own works really well together. And when I'm asked about medication, what I say to people is, you know, if you needed medication for a physical health problem, you are very likely to take that medication. Well, your mind is no different. Your mind is still a part of your body. You know, if you need to take medication for that, then, you know, absolutely, there's no reason why you shouldn't consider that. But I do think that medication on its own is not going to achieve what people want to achieve, and that people want to achieve, they want to get to the root of the problem and they want to deal with that. Medication alone, for me, does not deal with the root of the problem. It kind of helps with the emotional side of it for, you know, for a period of time, but if you want to deal with the root, medication and therapy together work really well, or therapy alone works really well. Medication on its own can help to ease the symptoms of individuals with high function anxiety. However, anxiety medication also makes therapy more helpful. So like I just said then, it will absolutely help with some of the symptoms to ease them, but it won't deal with the underlying cause. Now, in the case of high function anxiety, many people also fear that medication will dull them or take away their drive and ability to succeed. So like I mentioned in the previous slide, when somebody is diagnosed with high function anxiety, that is one of the first things that they will kind of worry about, is that if I treat this, does that mean I'm not going to be able to achieve high standards anymore? Does it mean people are not going to see me as being helpful anymore? Does it mean that I'm not going to be punctual anymore? And so on. And the answer is no, it does not mean any of them things. What it means is you can still be all of them things, but it's about kind of putting in place more healthier habits to take care of your own mental health, because continuing to put this constant pressure on yourself will eventually, if it hasn't already, start to take its toll on you. So many research studies demonstrate therapy to be successful in treating anxiety without medication, and I can absolutely vouch for that. It really is effective. Okay, so what would we do in therapy for high function anxiety? Well, as I've already mentioned, again, understanding the reasons behind the anxiety is very important. Then recognising unhelpful thoughts and getting them back on track. So a big part of anxiety is the negative thoughts and the worry that we experience. Thoughts create feelings, feelings create behaviours. So if we can deal with the unhelpful thoughts and worries, then we can help somebody to then kind of replace them with more helpful thoughts, which are going to help to change the way they feel. And as a result, their behaviours are going to be much more positive. Understanding and dealing with worries about the future, identifying fears and working through these, because a big part of this is fear driven, so we need to identify what them fears are. Working on the self-image and changing the relationship with their self, because one of the major factors in perfectionism and that fear of failure can be due to low self-worth, low self-esteem, and that self-image that we have about ourselves. So changing that and working on that is a big part of the treatment. Mindfulness is really good as well, because mindfulness is about helping people to be present, and you know, when their mind is in the future or in the past, it's giving them the techniques and strategies to bring their mind back to the present moment. So that can be really helpful for somebody with this type of anxiety, and developing healthier habits and behaviours. Okay, so just to finish off by saying a couple of things that treating the anxiety will and will not do. So it's really important to know that treating high functioning anxiety will not make somebody less productive, because like I've already mentioned, one of the biggest fears when somebody is diagnosed is that they start to think, well, without this anxiety, am I going to still continue to achieve great things? You absolutely are going to be able to achieve great things, but you're going to be able to remove the pressure that you put on yourself constantly to do that. It will not stop them from achieving, and it will not change who they are as a person. That is really, really important to understand. What treating the anxiety will do though is make somebody more productive, because we will direct their energy away from those unfounded and unhelpful fears that are manifesting these behaviours, this need to please, this need to avoid failure, this need to, to be at the top of your game all of the time. It will take the energy away from them unhelpful fears and help you to put the energy towards things that you actually can control. It will help you to feel better about yourself, learn to relax, prioritize your own needs without the feeling of, guilt or the feeling bad, and develop healthier and happier lifestyle. That is the ultimate goal, to be healthy and happy. So 100%, this anxiety needs to be addressed, and it will not change who you are or what you are. It will just remove the fear behind the behaviours, which will then in turn kind of remove the pressure that you put on yourself, if you've been able to relate to this presentation today. Now, if you can relate and you do want some support, then please do reach out. The CBT Hub has been developed to help people to understand the reasons why these things happen, and to be able to implement the techniques into your life that will help you to move forward to that healthier and happier lifestyle. So if you need any help or any advice, please do drop me an email at leanne@mindyourfuture.co.uk, and I'll be happy to answer any questions.